Welcome to Section 4 of Joint Health and Degenerative Disease, where we will be talking about ameliorating the risks that come with pain management medication. In 10 minutes, you'll learn the risks and benefits of NSAIDs, the importance of pain management, and some new options to manage pain in your patients. Our beliefs about pain management in our patients have changed dramatically over the years in veterinary medicine. 20 to 30 years ago, most routine postoperative surgery patients went home without any pain medication. The veterinary community was not in agreement that pets needed pain management post-surgery. This stemmed from a debate as to whether animals felt pain in the same way people did. On top of animal cognition debates, there was fear that if a patient felt too good, the suture line or fracture repair could fail. These are unethical pain management decisions. Similar to offering the option of intravenous fluids during anesthesia, some began offering optional pain medication at an extra cost. This left pain management decisions up to owner beliefs and their pocketbooks. Both of the aforementioned practices we now know are archaic. In fact, the use of pain to control movement is deemed unethical by the 2014 WSAVA Group on Guidelines for Recognition, Assessment, and Treatment of Pain. Pain medication should not be withheld. Veterinary science supports that all mammals have the same neuroanatomical structures that humans have to perceive pain, and pain medication should not be withheld from animals. For those at the forefront of pain management 20 to 30 years ago, they faced the limiting fact that there were not a lot of pain medication options. Non-steroidal anti-inflammatory drugs, known as NSAIDs, revolutionized veterinary medicine. They gave us the ability to have effective pain control that was fast-acting, generally well-tolerated, and affordable. NSAIDs allowed us to manage pain in ways we couldn't before. WSAVA guidelines note them as the mainstay of analgesia for both acute and chronic pain in dogs. Some early, highly publicized cases of adverse events in Labradors left some clinicians nervous about using NSAIDs for a number of years. Labradors were initially overrepresented in cases of carprofen-associated idiosyncratic liver cell death. Any NSAID has the potential to cause idiosyncratic liver injury. The incidence is not known but considered uncommon to rare. NSAID use must be tailored to the individual. Although in general the analgesic benefits of NSAIDs outweigh the risk when it comes to pain management, this is not to discount the fact that each individual's risk needs to be assessed thoroughly. Individuals receiving NSAID treatment need to be monitored while taking NSAIDs with regularly scheduled blood work and urine analysis. Know the risks for each of your patients. Leading veterinary comparative pain management advocate Dr. Lascelles notes, NSAIDs are the most widely used analgesics in veterinary medicine and all have some toxic potential. Most dogs and cats tolerate veterinary-approved NSAIDs well for short-term use. There are risks of acute adverse events such as GI upset or ulceration. There are much higher risks in cats, in patients with pre-existing kidney disease, or in dehydrated patients. Long-term use of NSAIDs brings new risks. NSAIDs in cats is a cautionary tale. Currently, only meloxicam is approved for long-term use in cats in Canada and Europe, but not in the USA. Dosing long-term is unique from post-operative pain doses. More than one dose of meloxicam in cats can cause kidney failure or death, and the effects of long-term use of other NSAIDs in cats are unknown. Cats are more sensitive than dogs to the side effects of NSAIDs because they metabolize drugs differently. When do owners pick up the phone? What are the specific risks of NSAIDs? Any common side effect of NSAIDs in animals reported to FDA's Center for Veterinary Medicine should prompt an owner to call for advice. This includes vomiting, decreased to no appetite, decreased activity level, or diarrhea. The veterinary team needs to be aware that NSAIDs can cause stomach and intestinal ulcers, stomach and intestinal perforations, kidney failure, liver failure, and death. The side effects of NSAIDs are mainly seen in the digestive tract, kidneys, and liver. There are therapeutic limitations of NSAIDs. NSAIDs are a critical tool in companion animal pain management. They eliminate pain, but they do not eliminate signs and symptoms of active disease. Why look beyond NSAIDs? Multifaceted joint supplement options may be preferable to maintain joint health and slow progression of disease through a variety of mechanisms, providing building blocks for cartilage, altering the inflammatory messages, and immune modulation. Antinol is a multifaceted joint supplement that's clinically proven to keep joints healthy, to slow disease progression, and to decrease inflammation and pain. Antinol may allow for a lower effective dose of NSAIDs. Antinol alone is clinically proven to be effective without the risk of serious adverse effects. Long-term use of NSAIDs are necessary for some of our arthritis patients. However, adverse effects are seen in 2.4 to 34% of canine patients. Antinol combined with carprofen in one study was the most effective approach. This synergistic effect may allow for greater individual dose adjustments. One may be able to use a lower dose of an NSAID in combination with Antinol, thus decreasing the risk of side effects. Your checklist for ameliorating the risks starts with knowing your patient's individual risk and monitoring requirements, coaching owners on the signs of pain but also adverse side effects they need to know when to call. Joint supplements may help slow disease progression along with decreasing pain. NSAIDs combined with Antinol appears to have a synergistic effect. Choose the lowest effective dose of an NSAID. Antinol is clinically effective alone. Thank you for joining us. Next up, we will talk about supplement options for joint health.